Hello, welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for December 16, 2020. Thank you for joining us this month. Our presenter today is Lisa Erck. Lisa's work is aimed at helping businesses create work environments that encourage employees to be happy and productive while at work. Currently, she serves as a worksite wellness consultant for the National Association of Chronic Disease Directors, or NACDD, where she supports the CDC Work and Health program and provides training and technical assistance to state health departments and employers around evidence-based workplace health promotion programs, policies, and strategies. Lisa, welcome, and I'll let you take it from here.
All right. Thank you so much, Ellen. Good afternoon. I am Lisa Erck, and as Ellen mentioned, I am a worksite wellness consultant with the National Association of Chronic Disease Directors, commonly referred to as NACDD. NACDD is a 501c3 nonprofit organization dedicated to increasing the capacity of state and territorial health departments through technical assistance and support. I am delighted to be here today to discuss our experiences leveraging partnerships to develop a sustainable approach to increasing arthritis-appropriate evidence-based interventions in employers. So what am I going to cover in our brief discussion today? First, I will outline the objectives of our CDC-funded project. Then I will discuss why employers should address arthritis and/or musculoskeletal pain. I will then move to discuss why employers should consider implementing With Ease, which is a CDC-endorsed arthritis-appropriate evidence-based intervention, also referred to as an AAEBI for short. And finally, I will spotlight the impact that Walk With Ease has had on one employer while sharing a tool that we have created called the Leveraging Partnership document. This document is available free for download from the NACDD website, and the direct link will be shared with you later on in the presentation. NACDD was funded to develop a successful model for partnering with national organizations, including community-based organizations, also referred to CBOs, and state-based business influencers to deliver arthritis-appropriate evidence-based interventions to employers. For the purposes of this project, is defined and success is defined as 1, the establishment of a commercial offering structure that uses non-federal funding to support arthritis-appropriate evidence-based intervention delivery, and 2, evidence of embedding or permanency of program offerings or referral processes within a system or organization, and 3, evidence of program delivery sustainability. So what is the role of employers in improving employee and population health? Employers are purchasers of health insurance, and they are key partners in implementing evidence strategies that can positively impact health. They are stakeholders who can improve the health of their employees, dependents, and the broader community. They are also the convener of workplace wellness programs. This can have a positive impact on population health with, of course, the necessary influence of community support. Why should employers address arthritis and/or musculoskeletal pain? Musculoskeletal pain is the most common reported condition for people ages 18 to 64. For most of us, that's our workforce. And is also the third most expensive benefit cost category to employers. Musculoskeletal pain is also frequent comorbidity with diabetes, obesity, and heart disease, and it can be a significant loss of productivity for employers. And as you will see in the chart on the right, arthritis will increase as our population grows and ages. But remember, arthritis is not only a problem for the elderly. Musculoskeletal conditions such as arthritis and back pain impact an organization's overall healthcare costs. In addition, they are associated with high costs associated with absenteeism, lost productivity and/or presenteeism, disability, and workers' compensation costs. Arthritis is the most common chronic condition among chronic users of opioids in the US, and in 2013, total medical costs and earning losses due to arthritis were $304 billion. Yes, that's billion. In 2017, the average adult with arthritis earned $4,040 less than an adult without arthritis. As you can see, arthritis is a high-cost burden to the United States and to employers. Musculoskeletal conditions outrank other conditions as a cause of lost workdays, with many implications for productivity. Arthritis is the nation's leading cause of disability and contributes to a lower quality of life for employees. Musculoskeletal conditions are common, they're painful, limiting, and sometimes debilitating. They affect people, as I mentioned, of all ages, and they can have ripple effects on quality of life and overall well-being. So why should employers consider implementing Walk with Ease as part of their worksite wellness efforts and/or part of their employee benefit package? Well, Walk with Ease is a 6-week walking program designed to help people who are living with musculoskeletal conditions and beyond. A walking initiative that is used to reduce pain, increase balance and strength, and increase physical activity. It provides participants with health education, stretching, and strengthening exercises, and motivational tips and tools to start and, most importantly, continue walking. It is an action planning tool. Among the benefits that Walk with Ease offers, some examples include that 1, it is a CDC-endorsed, clinically effective, evidence-based intervention developed by our partners at the Arthritis Foundation. It is easy to implement with flexible delivery modalities, including group-based classes, self-directed formats, and/or the enhanced version. As you can imagine, the flexibility of these different formats has been extremely beneficial during COVID-19. The guidebook is available in English or Spanish. It is relatively low cost. As I mentioned, it's available in self-directed, enhanced, and/or group format, so it's adaptable, and it's applicable to most employees. We've seen recently that Walk with Ease can be used independent as a standalone physical activity program or in conjunction with other lifestyle change programs to encourage sustainability. Walk with Ease can be coupled with other evidence-based interventions, evidence-based action planning physical activity components. Let's go into a few examples that we've seen in our work about how Walk with Ease has been coupled with other evidence-based strategies. We've seen some states couple with programs like the National Diabetes Prevention Program. There's also efforts to increase modalities as well as blood pressure control by pairing Walk with Ease with self-monitoring blood pressure control initiatives. Other examples include cancer prevention, chronic pain, and chronic disease self-management. Please visit the NACDD Arthritis resource page. The link will be made available to you at the end of the presentation, and read one of our success stories titled Montana Department of Health Expands Successful Worksite Walking Program for details about how our partners at the Montana Department of Health are integrating Walk with Ease into local diabetes efforts. As I mentioned, there are many benefits of Walk with Ease. Let me highlight a few more of the key ones that impact both the employer and the employee. Some of the key employer values include a reduction of direct and indirect costs, a reduction in comorbidity risks, healthier workforce with less risk of injuries and improved workplace safety, and as it also mentioned, it is an inexpensive, effective lifestyle improvement program. Some of the employee values include reduced pain, stiffness, and fatigue, increased stamina, balance, elevated mood and sense of control, increased physical activity, reduced risk of comorbidities, and last but not least, self-management skills. Walking is good for almost everyone, and it has many, many, many health benefits. So what is the impact of walk with ease on employer metrics? To outline this, I am going to spotlight some results from one of our employer projects. This employer is a large employer with 5,000 employees. 304 of those employees registered online for the initial Walk with Ease program. 249 complete the baseline survey, and 203 completed the final post-survey. Of those 249 baseline surveys, 27% identified as having some form of arthritis, 30% suffer from anxiety or depression, 27% have hypertension, and 23% have prediabetes or diabetes. What this chart shows you is that there is an opportunity to market and promote Walk with Ease as a way of managing multiple chronic conditions, as that self-management action planning physical activity component. Self-reported results captured using pre and post surveys show that Walk with Ease had a positive impact on physical activity, self-reported physical and mental health status, and last but not least, productivity. Let me share some specific highlights. We saw an increase in the percentage of the population walking 4 or more days. The statistics percent at baseline to roughly 60%. This is an 86% improvement. The number of people reporting that they had good to excellent health went from roughly 75% at baseline, almost 90% capture survey. Improvements were noted in health outcomes, including pain and fatigue. And the program appeared to have a positive impact on workplace productivity and presenteeism, which was measured by impairment while working. In addition, participants were highly satisfied with the program, and almost all participants reported intention to continue engagement. To document our experiences working with employers, NACDD created a Leveraging Partnership document. This, quote, living document provides the experiences to date of NACDD in working with partners to increase the adoption of Walk with Ease as part of employers' wellness efforts to reduce the burden of musculoskeletal conditions such as arthritis and back pain, all while increasing physical activity levels. And when I refer to this document as a living document, the first draft was published in May of 2020, and NACDD has plans to update this document over the course of the next year so that we can include additional experiences from our partners to make sure that this document truly reflects our expanded coverage as well as experiences over time. We also plan to capture some of those coupling of evidence-based strategies that I mentioned earlier in our presentation. This guide is intended to provide state and local health departments or an identified partner or stakeholder with a step-by-step approach to engage employers as payers of Walk with Ease. One of the best ways to reach employers is to leverage existing statewide partnerships with business influencers and to integrate Walk with Ease into existing statewide efforts with employers. Let's take a few minutes to explore some of these ideas. So who are potential business influencers? Business influencers are groups of individuals who have the power to affect purchasing decisions of employers because of their knowledge, position, and authority. Examples of potential business influencers include business groups on health, other forums on health, chambers of commerce, industry-specific trade associations, purchasers coalitions, human resource associations, and insurance brokers and benefits consultants. Examples of statewide efforts with employers could include the CDC Work at Health trainings. Work at Health is an evidence-based training curriculum for employers. It is delivered by train the trainers and or master trainers directly to employers. Throughout this curriculum, trainers teach employers a step-by-step approach to building a culture of health in their organization and implementing strategies that address their needs and interests. you can envision that something like Walk with Ease could be piggybacked on a work at health training and positioned as a physical activity walking program for those employers who have a need and interest in increasing physical activity levels, improving the work environment, addressing musculoskeletal conditions, and/or a population who is interested in targeting specific chronic diseases like diabetes or heart disease. Another example of a curriculum, in addition to the CDC Work at Health curriculum, is the Connect to Wellness platform. Connect to Wellness is an evidence-based workplace health program that trains government professionals to work with and support small and mid-sized employers in their effort to create healthier workplaces. The University of Washington's Health Promotion Research Center, HPRC, developed Connect to Wellness. Also might have local efforts to help employers utilize the CDC Worksite Health Scorecard. The CDC Worksite Health Scorecard is a tool designed to help employers assess whether they have implemented evidence-based health promotion interventions or strategies in their work sites to prevent heart disease, stroke, and related conditions such as hypertension, diabetes, and obesity. It provides guidance on key evidence-based strategies that employers can put in place to promote a healthy workforce, increase productivity, and reduce the risk associated costs of poor employee health. The interesting thing about the CDC scorecard is that in 2019, they added a new module on musculoskeletal conditions. Another effort that you might have underway in your state is a National Diabetes Prevention Program Employer Learning Collaborative, also referred to as the ELC. ELC is a unique opportunity made available by CDC, NACDD, and select state health departments, as well as select national partners that have expressed an interest and readiness to advise employers on offering the National DPP Lifestyle Change Program as a covered medical or wellness benefit for their employees. Again, if you have the ELC in your state and you have efforts underway to partner with employers around increased adoption of the National Diabetes Prevention Program, you could potentially consider an opportunity to piggyback the National Diabetes Prevention Program with Walk with Ease. Your state also might have local 618 initiatives underway with employers. 618 is a CDC program with evidence-based strategies and policies aimed at employers. Last but not least, you might have local policy systems and environmental change efforts to increase physical activity in your state. We identified some best practices for working with employers. Our hope is to share these in an effort to start a conversation and to provide guidance to others who are interested in replicating this work by partnering with national organizations, including community-based organizations and state-based business influencers, to deliver arthritis-appropriate evidence-based interventions to employers. Let me do these early lessons learned. 1, let's translate public health for an employer audience. What do I mean by this? Arthritis is generally not a concern for employers. Musculoskeletal conditions are. Adopting musculoskeletal terminology resonates positively with employers as it is one of their top drivers of medical costs. 2, community-based organizations and other providers can be great partners. Employers are generally not aware of local resources, including community-based organizations and other services and benefits that they can provide. One of your roles as a business influencer and or expert in your state might be to connect local employers to local resources and community-based organizations and or Walk with These leaders who can deliver on-site or virtual-based evidence-based programs. 3, we need to understand the unique needs of our employers. Employers are interested in improving their employees' health, but they are often looking to experts to understand their unique needs, to be knowledgeable of the best practices, and to make appropriate recommendations as to which policies, benefits, and programs would make the most beneficial sense to their organization. 4, we want to make sure that we are promoting the right arthritis-appropriate evidence-based intervention. Right now in the employer arena, we've found the most interest in Walk with Ease. Walk with Ease is an easy to implement, low-cost walking program that fits the needs of most employers. The flexibility Walk with Ease offers allows it to be easily integrated into an employer's ongoing wellness programs or provide a low-risk starting point for new employee well-being efforts. And finally, we need to help make the business case. Employers are interested in understanding the value on investment and/or VOI and the return on investment, ROI, of well-being efforts, including Walk with Ease. When we include employer metrics in our pre and post surveys, we can capture the data to make the business case back to leadership about the impact and opportunity that these programs can have on the overall organization. This work wouldn't be possible without our fabulous partners. You will see on this list representation from various business influencers, including state health departments, purchasers coalitions, and nonprofits. As I mentioned, this is a living document, so we hope that this list of partners continues to grow over time. NACD has a resource page where you will find links to tools and resources, including customizable flyers for Walk with Ease, the leveraging partnership tool I mentioned earlier, several success stories. Links to these resources will be shared directly with you after this webinar. And this concludes my presentation today. Feel free to reach out to me with any questions or if I can help provide any assistance to you or your organization. I also want to mention my amazing colleague, Heather Murphy, who is the powerhouse behind the arthritis work at NACDD, and our extremely thorough and fantastic evaluator, Michelle Whitaker. In addition, I want to thank CDC for their partnership support, and thanks so much to the Arthritis Action Alliance for having me today. And that concludes my presentation. Thanks.
Great. Thank you, Lisa, for that fantastic and informative presentation. We have time for a couple questions, and just as a reminder, you can type any questions into the chat box. So while you're typing, I wanted to let everyone know that Lisa is graciously sharing some resources, which you can see in the chat box, and we'll also be sending those out in an email. You'll receive that later this week from Katie Huffman. Also, in a few minutes, you will see a poll pop up on your screen with some survey questions. Please answer those before you leave the webinar. While we're waiting for any questions to come into the chat box, I actually have a question for you, Lisa. You had mentioned employer metrics, and which employer metrics have you found to be the most important when evaluating the impact and value of Walk with Ease and other evidence-based interventions?
Yeah, that's a great question, Ellen. And I mentioned a couple in the spotlight of employers, but I think we really want to talk and help employers see the impact on things like productivity and presenteeism. So really educating employers about the impact that it can have on their organization if an employee is coming to work, but they are unable to perform at their fullest capability or capacity because they are suffering from musculoskeletal conditions, arthritis, and/or other chronic conditions. So I've definitely seen a lot of interest in productivity. Naturally, many employers are also very cost-driven. So we want to make sure that we can ultimately tie things back to healthcare costs and various other measures like that. I only caveat to make sure that we are setting clear expectations with employers about when they can realistically see a change in healthcare costs. That is usually a mid to long-term ROI measure. So we want to make sure that we're not promising changes in healthcare costs in a matter of 6 months. And then last but not least, people are really interested in kind of creating a culture of health. So they want to make sure that their employees feel valued, supported. We want to make sure that the organization really is taking care at really providing the most opportunities for them to be their best and to improve well-being. So really focusing on those satisfaction measures, recruitment and retention, and various other things that can have an impact on the overall bottom line.
Terrific, thank you. And I see a question just came into the chat box. Have you seen employer interest in Walk with Ease go up since COVID popped up earlier this year?
So that is a great question. And I think we are starting. So in general, I think Heather and I have definitely seen an increased awareness of Walk with Ease in the last kind of 6 to 12 months. I think part of that is because of the versatility of Walk with Ease and the fact that during COVID, we didn't really have to change gears too much. As I mentioned, Walk with Ease is available in 3 different modalities. So the self-directed and enhanced version of Walk with Ease didn't have to change at all because of COVID-19, because those classes are relatively self-directed and self-paced. They're often supported by virtual mechanisms like Zoom and or email or specific encouragement messages. So the only thing that really had to transition during COVID were the group classes, and many of those were able to change really quickly to a virtual platform and or to the self-directed or enhanced version. So I think the fact that Walk with Ease can really be nimble has been very attractive. We've also seen that many employers are looking for opportunities to support their employees who are working remotely or virtually during COVID-19. So the fact that they can promote something like Walk with Ease, send them directly a guidebook, use an automated portal like the portal available through the Osteoarthritis Action Alliance to support them in messaging, that is something that employees can feel supported directly from their home when they're being asked to work from home and or practice other social distancing protocols. So I do think that it's important and a great question, and certainly I think we're starting to see more interest due to COVID, and also the fact that Walk with Ease is gaining more traction and awareness over time. We've also seen that this is directly a result of COVID, although the fact that many other lifestyle management programs are moving virtually because of COVID, that idea of coupling evidence-based strategies has really gained momentum in the last 6 months. And I think part of that is because of the fact that many of those evidence-based strategies are moving virtually and can easily be paired with like the guidebook from Walk with Ease.
Great, that's terrific, thank you. And can you share some innovative strategies that employers have used to engage participants?
Yeah, that's a great question. And one of my favorite ones is the idea of Walk with the CEO. So we have seen recently before COVID, they were organizing kind of group-based opportunities for individuals who are participating in Walk with Ease to come together and to walk with the CEO. And the CEO would often hold kind of the weekly walk, and they would follow the guidebook of Walk with Ease. So I love that example, and what I think is really funny about that example is that we found that many of the participants didn't necessarily join the CEO because they wanted to walk. They joined the CEO because they wanted an opportunity to have the ear of the CEO, and right. Walking was an additional benefit. However, we are always creative, and we love any unintended consequence that gets in. So we get a twofer. You get the ear of the CEO, and you get the ability to walk during the course of your day. And I've seen some organizations who have continued that even during COVID, and they have virtual walk and or they have socially distanced walks directly with the CEO that follow local guidelines and protocols. So that's probably one of my favorite. Another innovative strategy is the idea of using existing health coaches within their organization, training them as Walk with Ease leaders, and then coaching option of Walk with Ease directly into their coaching services and disease management programs that are offered through their health insurance provider and or their direct on-site coaches. Those are 2 ideas that come to mind, Ellen.
Oh, those are great. I love those ideas. Since the Walk with the CEO is terrific. Just one final question. Do you have any advice for partners to collaborate with employers to improve employee and population health?
So I think the first advice is certainly take advantage of the NACDD leveraging partnership document and the step-by-step approach we've outlined. And the second idea is to really sit back and brainstorm who are potential stakeholders and partners in your state that you could leverage and really think about integrating and embedding Walk with Ease into existing efforts that are happening across your state. There's no need to reinvent the wheel. And I think we've seen that by opening up the door and talking about conversations, the versatility of Walk with Ease as that sustainability component, I think surprised by the interest you have across your state from business influencers, insurance providers, and partners. And last but not least, don't forget those business influencers I mentioned, chambers of commerce, business health coalitions, purchasers coalitions. They are fantastic partners who can really help you gain additional reach for your program efforts.
Excellent advice. Thank you so much. And thank you for the presentation, Lisa. And thanks to everyone for joining. That concludes today's presentation. Please join in next month's Lunch and Learn on January 20th, 2021. Dr. Mary O'Connor, Chair of the Movement is Life Caucus, will be presenting Movement is Life's Operation Change,
a model for community engagement. Happy holidays, and we hope to see you in January.